Hello, and welcome to the Sickle Cell Mental Health Initiative track of the Sickle Cell Community Consortium. My name is Clayton Andrews. I am a licensed professional counselor and a Sickle Cell Warrior, and I would like to thank you for joining our discussion on sickle cell and post-traumatic stress, the unique experience of the Sickle Cell Warriors' battle with post-traumatic stress. Post-traumatic stress disorder, generally defined as an anxiety disorder initiated by an exposure to a discrete traumatic event that has generally occurred in the past and characterized by symptoms such as re-experiencing, cognitive or behavioral avoidance, reminders of the event, and physiological hyperarousal. The symptoms associated with PTSD include re-experiencing, hyperarousal, and avoidance. An important side note is that prior trauma increases the risk of illness-related PTSD. Re-experiencing is exactly what it sounds like. It is a mental reliving of the trauma. It can include intrusive thoughts, flashbacks, and nightmares. For many people living with chronic illness, re-experiencing is particularly alive during interactions with doctors and hospitals. Driving by the hospital, for example, can incite panic. The prospect both of testing and treatment procedures creates tremendous anxiety. Some of us have particular memories, botched procedure, traumatic blood transfusions or experiences afterwards, adverse reactions, hospital stays that were particularly traumatic, or even unsympathetic doctors. Others of us have fragments of memory that have not been processed and don't make coherent narratives. We only know that we are terrified. Hyperarousal symptoms for chronically ill are manifested as an intense awareness of bodily sensations. A fair number of clients have been dismissed by their physicians as hypochondriacs. Their acute attention to somatic discomfort is not properly identified as a trauma symptom. Difficulty sleeping and irritability are also hallmarks of PTSD hyperarousal. Avoidance occurs as a way of managing the intense anxiety that accompanies re-experiencing and hyperarousal. We find ways to avoid the hospital, for instance. Perhaps we miss doctor's appointments and fail to schedule follow-up testing. We also find ways of avoiding our bodies. Some self-medicate, some use alcohol or drugs to forget to pick up prescriptions. The fear that we experience when we think about our illness and how we feel about it impacts us on a great level, so that avoiding anything to do with it seems like the only way to manage. If you have had prior trauma in your life, including cumulative developmental trauma experienced in childhood, there's a good chance that it's going to come up again as part of the illness experience. Sickle cell disease as a chronic illness. People who live with chronic illnesses are at greater risk of experiencing PTSD-like symptoms. However, the trigger for these symptoms is not a one-time event that occurred in the past. Rather, chronic disease is an ongoing threat to safety. It's estimated that 12 to 25% of people experiencing life-threatening illness develop medically induced PTSD. We know that the health consequences of PTSD include diminished mental and physical quality of life. Of a particular note is that PTSD produces neurobiological alterations, including higher inflammation levels that negatively affect health. PTSD can also affect adherence to medical treatment, as people who use avoidance tactics to manage their symptoms are less likely to take their medication, implement lifestyle change, or see their doctors and follow up with their visitations. So what happens when illness triggers PTSD? We've already discussed how trauma can come in many different forms. And what causes the lasting post-traumatic stress, those symptoms for one person can be different for everyone else. That doesn't mean, however, that your experience isn't real or valid. The same goes for PTSD, that's the direct result of living with chronic illness or illness induced PTSD. Most trauma come from the external environment, such as a natural disaster, attacks, assaults, war, for instance. We have the coronavirus pandemic going on right now. That's an external event. Medical trauma, however, comes from within our bodies. From chronic illnesses, our bodies are the source of the danger. And as such, it can seem that a safe haven is not available to us. Shock, disbelief, terror, heightened anxiety, fear of the future, and disillusionment in the medical establishment are very prevalent with this illness. The most salient is the changed understanding of our own vulnerability to pain, suffering, and death. Our previous worldview, one in which the world and our place in it were things that we understood, has been shattered by illness, and our perception of safety has been altered irrevocably. So, what should you know about chronic illness induced PTSD? And who gets it? Illness induced PTSD is defined by clinically significant post traumatic stress symptoms, those that result from acute or chronic illness. 12 to 25% are estimated to survive a perceived life threatening medical event that will develop PTSD. In a study of patients with Crohn's disease, for instance, 19% screened positive for a PTSD diagnosis. Illness-induced PTSD can be the result of any chronic illness that includes sickle cell disease, though it has been best studied in conditions such as heart issues, stroke, and cancer. And when it comes to cancer, typically when we go to our emergency visits, I don't know about your experience, but my experience is they typically put me on the cancer floor. So that's something of importance to note because sickle cell disease is such a chronic illness. So how is illness-induced PTSD different? There are 4 ways in which illness-induced PTSD is different from traditional post-traumatic stress. The first example is that the chronic illness does not have a fixed endpoint. The first major difference is that illness-induced PTSD often involves ongoing and internal threats rather than external and time-limited events, such as a single assault, for instance. Whether it's the daily symptoms or walking on eggshells between flare-ups or wondering how long remission may last, you may face trauma triggers and reminders every day. Researcher Donald Edmondson, Ph.D., used the term enduring somatic threat, or EST, to describe how PTSD is unique for those with the chronic illness. Without a definite endpoint, chronic illness remains a major part of the current reality. L. Gabelway points out that you also can't easily escape or avoid your own chronic illness, especially when treatments and follow-up medical appointments and procedures are necessary. 2, illnesses are internal and not external, as we mentioned before. Often we think of trauma as something that happens outside of you: abuse, combat, natural disasters. Medical trauma, however, happens due to external sources as well: surgery, interactions with medical professionals. However, with chronic illness, that's not something that is external. It is going on internally in part of your body. Unlike other forms of PTSD where you can walk away from your triggers or remove yourself from your triggers, it is not possible with chronic illness. And that difference matters for several reasons. Dr. Edmondson wrote, with serious illness, consequences may last for years or place ongoing threats squarely in the body of the survivor. It's very different to treat and manage trauma that you carry with you on a daily basis. Your PTSD symptoms may also be directly tied to nearly indistinguishable at times. The example of heightened anxiety related to bodily sensations such as pain, which can be triggering and difficult to pin down. The third way in which illness-induced PTSD is different is the need to be on high alert constantly. Hypervigilance, or being on high alert, is one of the classic signs of PTSD. In traditional PTSD therapy, you might learn that the traumatic events are over at some point and in the past, so you can rev your alertness. The revving up of your alertness is no longer needed. However, living with this disease and living with the chronic illness, that hypervigilance is a constant factor. Your doctor, for instance, may ask you to watch carefully for specific symptoms or changes in your health. You must follow medication or treatment plans carefully, and you're often required to modify your daily activities based on your condition. These considerations are necessary for your physical health, but they keep your nervous system locked in a heightened state of vigilance. Over time, this leads to other PTSD symptoms such as insomnia, fatigue, isolation, and they can even worsen your chronic illness symptoms. And then the fourth key way in which illness-induced PTSD is different is you worry about your future as well. So it's not only a concern about the past or the present events going on that are traumatizing you. You're worrying about what will become of me. Typically, intrusive PTSD involves memories or triggers about events that have happened in the past. However, your chronic illness and those triggers are ongoing. Therefore, those intrusive thoughts may be both past and future oriented, such as related to the uncertainty of one's health trajectory. L. Gabbleway stated that one study found that 81% of intrusive thoughts associated with illness-induced PTSD were related to fears about the progression of the condition. So discussing sickle cell and PTSD as a shared body or a shared organism, we can say. We know that post-traumatic stress disorder is a psychiatric disorder occurring in people who have experienced personal trauma or witnessed traumatic events. The exposure to that traumatic event can be indirect rather than firsthand, such as learning of a violent death or a close family member. In sickle cell patients, however, their own medical condition creates that mental stress, and with the anticipation of constant pain, discomfort, hospital visits, mistreatment, that can in turn cause the smaller blood vessels to constrict, thus triggering another pain crisis. So the actual stress and worrying about that causes the physiological response of more pain, more trauma. It's not just living with the symptoms that lead to illness-induced PTSD. Encounters with the medical system, for example, from invalidating doctors to invasive tests to surgeries and other procedures, those can be traumatizing as well. Other ways your life changes after a diagnosis, such as the financial toll, job loss, navigating your social relationships, or finding new ways to do so when others don't understand what you're going through, have a huge impact on this as well. The experience. Patients with sickle cell suffer from both witnessing traumatic events and having to experience them. The trauma of having repeated painful episodes of the chest, abdomen, back, joints, coupled with painful medical intervention, needles, surgeries, blood transfusions, worrying about the potential of failed blood transfusions or negative reactions, those all present an ongoing cycle that typically begins in childhood. Most people with PTSD have recurring, disturbing, and intense thoughts and feelings related to their last experience with that traumatic event long after the event has ended. For sickle cell patients, there is very little time in between these traumatic events. Pain crises can be unpredictable, and the flashbacks and memories to the next new traumatic event can be just as unpredictable. In between the pain crisis episodes, the sickle cell patient, like with any patient with PTSD, exhibits avoidance behaviors of any situation or person that may remind them of the traumatic event and display strong negative reactions to simple things such as an accidental touch or loud noises. The emergency department, for example, is full of loud noises with monitor alarms, people presenting their worst, the hustle and bustle of the ER. All those stimulations can present as stressful. Just being a visitor within the emergency department, there is always a possibility of being exposed to any patient suffering. Because sickle cell anemia patients are frequently in the ER of their own for their own care, they witness other suffering as well, which can be, again, stressful and triggering. Often these patients with sickle cell begin to know each other in certain settings or recognize each other where patients meet on inpatient wards or in the hematology clinic. As a result, they begin to care for each other as a community, even mourning the losses of each other while constantly thinking about their own health and mortality. This undiagnosed post-traumatic stress disorder in sickle cell patients creates another form of healthcare bias. The impact of illness-induced PTSD. Illness-induced PTSD can have major consequences on your life, including your illness. One study found that those with PTSD were 4 times more likely to experience worsening chronic illness symptoms than those without PTSD. PTSD can also lead to other complications because it doesn't just affect your brain. It interacts with changes in your autonomic nervous system, which controls involuntary bodily functions like heart rate, digestion, and sweating. If you're struggling with illness-induced PTSD, you're more than likely to avoid doctors, treatments, or taking medications because they can be painful reminders of the present ongoing trauma. The act of scheduling medical appointments, for example, going to a hospital, or even having a procedure often triggers flare-ups or setbacks for people with chronic illness. We can develop brain fog, feel shaky, have trouble sleeping. Sometimes we avoid doctor visits altogether, despite the possibility that our symptoms can get worse. We also have flares even when we've gone to help a family member rather than ourselves. These kind of behaviors and bodily responses are evidence of more than simple stress. They're normal indications of unresolved trauma. One study found that stroke survivors were 3 times more likely not to follow their medication symptoms schedule when they had PTSD. You may also have intrusive fears around death and dying, which is common in illness-induced PTSD. Research shows a recurrent fear of death makes it harder to follow through with necessary medical care. Managing illness-induced PTSD. So, if you're struggling with illness-induced PTSD, and a lot of the information presents sounds scary, it's important to know that you're not alone. L. Gabaway recommended working with a therapist with expertise in cognitive processing therapy, focusing on challenging and modifying unhelpful beliefs regarding their illness and the uncertainty of their health trajectory. She also said that acceptance and commitment therapy, which has a mindfulness component, is helpful for facing illness-induced PTSD symptoms. Other ways of managing illness-induced PTSD, including attending therapy regularly, include encouraging loved ones to attend their own therapy. That helps them to get the support and guidance that they need to learn how that they can best support you. Seeking mental health medication by working with your doctor or psychiatrist if needed. Finding a supportive network of loved ones who can go with you to medical appointments, help your other care needs, and be willing and available during emotional ups and downs. Getting involved in support groups that focus on stress management, self care, or a support group for patients with a medical illness. Engaging in activities that promote expression, such as drawing, painting, making ceramics, journaling, or dancing. And doing activities that promote body movement, yoga, tai chi, walking, swimming as much as possible. And just simply introducing as much joy into your life as possible. Daniela Pallone, a therapist, provides therapy for those with chronic pain, indicates that she recommends working with a chronic illness informed therapist who can provide support, understanding, and coping tools to help manage chronic illness, PTSD, or both. She often uses mind body approaches, relaxation, and encouraging self care to calm your body's stress responses. Sickle cell disease patients are subject to significant healthcare disparities, as often they are not offered mental health counseling as part of their comprehensive care teams, like any other patient with chronic and potentially fatal medical diseases, such as cancer patients. Sickle cell anemia patients live in constant fear of death and dying in a prolonged, tortured, painful state. Like many patients with chronic pain syndromes, sickle cell patients also express anger, hopelessness, and despair regarding their fate with having a seemingly incurable disease and their own quality of life. Many patients who attempt to seek out higher education and employment must also cope with the stress of frequent absences and increasing medical costs. Sickle cell patients should have access to mental health professionals as part of their treatment guidelines and protocols. Further looking at treatment for illness-induced PTSD. The EST model of PTSD recognizes that chronic illness presents enduring rather than discrete threats. The dangers experienced in the past due to our illness will likely reemerge. Thus, treatment should focus heavily on developing coping skills. For some people, this presents pretty straightforward. For others, particularly those with developmental trauma, this proves difficult. A good psychotherapist can help you build coping strategies that will help you feel safer and more in control. Some of these strategies include self-talk, support networks, multi-step plans to see you through medical crises. As you feel more in control, hyperarousal can decrease. Good psychotherapy also helps to diminish re-experiencing symptoms by supporting you in developing a narrative of your illness experience. Those fragmented flashbacks need to be named, felt, and placed into the story of your life in order to be integrated. And finally, psychotherapy addresses avoidance symptoms both behaviorally and emotionally. You deserve access to your body in a way that doesn't always hurt, and a good therapist can help you find and maintain that access. In general, making time for enjoyable activities, spending time with loved ones that promote joy is important. Making the most out of good moments in life and taking the time to savor those good times are also very healing. Researchers in this field have recognized something called post-traumatic growth. That is, people can and do use adverse events such as chronic illness and trauma to make positive changes in themselves, in their relationships, and in their worldview. The adjunct involvement of a mental health professional would seek to resolve the anxiety in both children and adults with sickle cell disease when presenting to the hospital setting. Most importantly, PTSD of any kind, illness-induced or traditional, it is not in your head. That is the most important thing, is to validate that this is not something that's just in your head. For those with chronic illness, you may have been told by one or even more doctors that your chronic illness symptoms are all in your head or a mental health condition, especially when the word trauma makes it into conversation. If you have a chronic illness and your doctor knows you have a history of trauma, they may have told you that your symptoms are psychological or all in your head. This may have happened if you have an illness that can't be diagnosed. This is all too common a perspective and traumatizing as well as it is inaccurate. It has also been disproven. It's worth to repeat. Chronic illness is not imaginary or in your head. You can have both a chronic illness and illness-induced PTSD. It is also important to note that getting help is paramount for this disease. You want to be able to take care of yourself, to take care of your body, and to take care of your mind. Thank you so much for your time. And that concludes this presentation. If you do have questions about mental health and sickle cell, or PTSD and sickle cell, or mental health, please do not hesitate to contact me, or in reference to joining the mental health initiative with the Sickle Cell Consortium. Again, my name is Clayton Andrews. I can be reached at clandrews1@gmail.com or at 706-951-7147. Thank you so much for your time and have a good day.